name is Tim Harima. I'm one of the preceptors at the Hanover training site for the Department of Family Medicine through UWO. I've been here for about 4 years now, I guess. And I was actually through Hanover as a medical student and really enjoyed my time here. Supervised by Dr. Dworkin, who's now one of my colleagues. And just really enjoyed the variety of experiences through the office, through the emergency department, working on the floor, doing some obstetrics, anesthesia, kind of doing the whole package, and sort of seeing that rural family doc really does have quite a role to play in providing medical care, distant from specialty care. And I really enjoyed that. I really liked the people here and the environment. Ended up coming back as a third-year resident. I did a PGY3 in emergency medicine, and did some time as a rural resident for that as well. And yeah, when the time came, I joined the staff here, and shortly thereafter we became a training site. I tried to pass on some of those enjoyable experiences that I had when I was a resident in terms of that variety of care and one-on-one teaching experiences, where a lot of bedside teaching as people sort of come through the emerge is where I tend to do a lot of my teaching, but also in the office at the end of the day, run through cases and teaching around some of the questions and the gray zones, and yeah, learning on the job I think is a really important quality of the program here, and that one-on-one I think is a little unique in compared to some of the training sites for a little more higher learner to preceptor ratio. So I think Hanover is really good in that respect.
Well, I'm Rochelle Dworkin. I'm the site director here at the Hanover site for the Rural Family Medicine Training Program through Western University. And we started the program, we're going into our 4th year, and the experience has been very, very positive. The first year we started, we only took 1 resident, and everyone, all the other doctors in the clinic were quite jealous of me having the resident, and so we thought by the next year we thought, well, the maximum we could take was 3, so we decided to take the 3 residents, and we have 6 preceptors, so 2 per resident, a senior and a junior preceptor. And we pretty much have 2 or 3 residents here at all times now, and I think the experience for the residents has been, what I perceive has been back, the feedback I have back has been very positive. They get a lot of experience, they feel that they get a lot of hands-on experience, they see a wider variety of patients, they feel that they're perhaps in some of the urban centers, and certainly seeing much more variety because they're involved in the emergency room. So they do emergency work and a lot of walk-in clinic kind of stuff through the emergency room. They're seeing inpatients every single day, so they get a wide variety of internal medicine patients and have a lot of responsibility for the inpatients. And they do see patients in the office, and they're also doing obstetrics and also actually even some anesthesia. One of the positives I think that we really get in our program is the volume of obstetrics that they see. The residents have to have 3 family doctor deliveries with a family doctor who does obstetrics, and they'll probably get that within the first month of their training here, and we'll do probably upwards to 60 deliveries during the 2 years here in Hanover. So it's been, I think that's been one of the big positives for them. They get their own office areas, they have a nurse that helps them, that's all completely computerized here, and we've started to develop a very extensive education program as well. Because it's a rural site, we feel, I feel a lot of their family medicine stuff they can get through their training through the university and the teaching on Wednesdays. So we've developed an auxiliary rural skills training program. So we've done some obstetric skills, some neonatal skills, airway management skills. The residents were given we actually had an ATLS course that the residents were able to take part in, funded by the doctors in this clinic. So we've had some extra training for them for rural skills, and I think that's also a very positive thing for the residents, so they are able to be competent to practice in a rural site when they're finished the training program.